So recently I saw a patient who comes in for a regular checkup. So his BMI is around 32 and that puts him under the obese category. So basically, he's coming in for a regular checkup. He has a very sedentary lifestyle. He does not exercise regularly and he's very hardworking, but because he has to prioritize his work, he misses out his regular exercise. He eats out most of the time. Unfortunately, his average blood sugar is around 200. So when you look at the A1Cs, A1C is around 7.5. So now I have to diagnose him with type 2 diabetes, and most likely this person also has insulin resistance. Let's watch this short clip from my YouTube video on trying to understand what is insulin resistance and how insulin resistance causes type 2 diabetes. Say you eat too many refined carbohydrates like bread or sugar. Our insulin secretes from pancreas to keep the blood sugar down. So some of the glucose gets used up by the exercising muscles. The rest of the glucose gets stored in the muscle and liver, and the excess glucose after that, they get converted into fat. So we all have fat stores in our body. So there are fat stores that are present outside the organ that is called as the subcutaneous fat, and the fat stores that surround the organ which is called as the visceral fat. So we just don't understand why one develops insulin resistance and one doesn't. The prevailing theory is that we all have different levels, different amount of fat stores in our body. So for example, let us say we have one person has like 5 bags of fat stores on the subcutaneous fat. The other person might have only 3 bags of subcutaneous fat. So once they fill that 3 bags of subcutaneous fat, the rest of the fat just goes around the organs. And our body doesn't like that, which is why our body starts developing insulin resistance. So basically our body says that, you know what, we cannot just keep putting the fat around the organs, so we need to stop this from happening. And this leads to insulin resistance, thereby causing the pancreas to secrete more insulin to overcome the insulin resistance, and thereby this diabetes develops eventually because the pancreas is not able to keep up the demands of the insulin resistance. Even though I just mentioned sugar in this particular video or just the white bread, but remember the hidden sugar that you consume in the foods that you enjoy. So for example, like it could be from cookies, it could be from donuts, it could be from ice creams. And also, like we talked about the refined white bread in this video, in this short clip, but also think about all the processed flour products that we eat, like pizzas, burgers, and all those things. They all cause insulin resistance too. And remember, when we have a lot of fried foods or unhealthy fats from animal fats, those trans fats and saturated fats also can cause insulin resistance and thereby increasing the risk for type 2 diabetes.